We've seen some terrible examples.
Sex between nursing home residents and the unlicensed staff who work there. If it's consensual, it's legal in Utah, even when there's a clear power imbalance.
I just don't like that idea of a power dynamic being used to exploit our vulnerable.
Some advocates say these relationships expose a gap in Utah law, one that leaves vulnerable adults unprotected and allows employees to move between facilities with little oversight.
There's really no penalty or punishment for them on that. And so they can just hop from facility to facility across the state.
I'm Fox 13 investigative reporter Taylor Stevens. As our Care in Crisis series continues, I'll explain what we know about this problem and the complex debate over what accountability should look like.
An elderly gentleman, he thought he was in love with one of the nursing assistants.
Kaylin Wooten leads the Medicaid Fraud and Patient Abuse Division in the Utah Attorney General's office. Last year, she told lawmakers about a case involving an elderly man in a nursing home and a nursing assistant more than 50 years younger.
And that nursing assistant made him feel, or told him, that he would be able to move out of the facility, move in with her, and they were in love.
But Wooten says the relationship wasn't what it seemed.
In reality, she wasn't interested in men. She had a partner. She just slept with him because she wanted his money.
Mortified, the resident refused to move forward with prosecution for financial exploitation. And because he'd consented to the sexual relationship, Utah law offered no other avenue to hold the employee accountable.
Imagine when that relationship, if there was a real relationship, goes south, those same people have to bathe them and dress them.
Utah law clearly prohibits non-consensual sexual contact with patients in facilities. And it criminalizes sexual relationships between adults and minors, and jailers and inmates, even when both sides say it's consensual. But in long-term care facilities, consensual sex between unlicensed workers and residents is not a crime, and there are no professional consequences.
I think this is happening frequently enough. We probably need to look at what sort of standard we can set up and what sort of protections we can put in place.
Senator Jennifer Plum sponsored a bill last year to criminalize these relationships. She says it isn't clear how often this actually happens, since there's no reporting requirement. But
when you bring a conversation up like this with policy, it is interesting how many people say, oh, let me tell you what I saw happen, or let me tell you what happened in my family, or let me tell you what happened with me.
Plum, an emergency room physician, notes that entering a consensual relationship with a patient could cost her license.
If someone is not licensed, though, there really isn't a lever to have the ability, one, to potentially pursue any sort of consequences or justice from it, or to have any traceability from it.
Many employees in nursing homes and assisted living facilities aren't licensed, including food service employees and housekeepers. CNAs, who play a big role in providing care, are registered, not licensed. Without a license, no board can discipline them, so there's no record of past concerns if an employee goes to apply for another job.
That then brought stories out of individuals who had jumped from one facility to another facility to another facility.
Plum's bill ultimately failed to make it through the House. Not everyone agreed criminalizing these relationships was the right approach.
We really tried to find a compromise, but we ultimately couldn't.
Nate Krippus is with Utah's Disability Law Center, which opposed the bill. He argues it was too narrow, outlawing only the sexual relationships in long-term care facilities that involved so-called vulnerable adults.
My colleague uses a wheelchair, and if each of us were to engage in sexual conduct with a nurse who was providing us care or something like that, it would be a crime for that nurse if she or he did that with him, but not with me. And that really seemed discriminatory to us.
Krippus thinks a better solution would be creating a way to track misconduct through licensing.
If there's a subset of the healthcare industry that, the CNAs or the techs or whatever they are, that are unregulated such that they can go around and engage in activity they shouldn't, get fired, and then just go get another job, I don't think the answer is to criminalize that.
If there was a way to handle it with licensure, I'd actually prefer that. The unprofessional piece versus the unlawful piece, I like that better. But there's no way with a group of folks that are never all going to be licensed. And there's just no way. as a state that we could do that.
Plum told us she doesn't plan to pursue this issue in this year's legislative session, but may explore it again in the future. And while she believes criminal penalties are the best approach, she said she's open to other ideas for addressing these relationships.
It may be that all we do ultimately get out of this is that awareness piece.
Taylor Stevens,
People's maybe feeling that they can advocate for themselves or for their family members.
Fox 13 News,
To me, that's still a win.
Utah.